So here we see a blood capillary with the endothelial cells, and the blood is going to enter from an arteriole into the arterial end of the capillary. The blood is going to go through the capillary. In fact, we could draw a couple of red cells just to show the blood going through the capillary. There's some red cells in the blood capillary. And of course the blood will leave to drain into the venule out of the blood capillary. And what we see here is these are the individual tissue cells that are being oxygenated by the blood going through the capillary. So these are the cells comprising the tissue. But what we see here is that some bacteria, these dots here are bacteria that have got into the tissues. And a good definition of infection is that bacteria are in the tissues. That is what an infection is. It's microorganisms growing in a tissue. And of course we don't want the bacteria to get into the blood, because by definition that will cause a bacteremia, making sepsis, systemic sepsis, much more likely. And we don't want the bacteria to be left in the tissues, because these bacteria can double their numbers every 20 minutes to half an hour, causing a significant local infection. And that local infection can spread to become a systemic infection, potentially even a life-threatening infection. So we don't want bacteria left lying around in the tissues. So fortunately we have these lymphatic capillaries. So here's the outline of the lymphatic capillary around here, the blind-ended lymphatic capillary in the tissues. And we see that the endothelial cells that make up the lymphatic capillary are fairly flappy and loose, because the basement membrane surrounding the lymphatic capillary is incomplete, and this allows relatively large objects to go between the gaps in the endothelial cells. And once a bacteria has got into the endothelial cells with some tissue fluid, then the cells flap and form a valve. So these flappy cells mean that material, which could be tissue fluid, which could be proteins, in this case bacteria, are able to get from the interstitial spaces here into the lumen of the lymphatic capillary here, and then the endothelial cells will shut, forming a valve, retaining the contents in the lymphatic capillary, in this case bacteria. But of course tissue fluid goes in here normally as well, physiologically. And when the tissue fluid enters the lymphatic capillary, it changes its name. It's a bit like getting married. The name changes. So it changes from being tissue fluid or interstitial fluid when it's in the tissue spaces. When it's in a lymphatic capillary, we call it lymphatic fluid, or simply lymph. But here we see bacteria going from the tissue spaces into the lymphatic capillary to be carried away in the flow of the lymphatic fluid, and we'll see what happens to that in the next section. But for now it's also worth noting that these lymphatic capillaries are in fact contractile. The individual cells that make up the lymphatic capillary can contract, and that will increase the pressure in the lumen of the lymphatic capillary, propelling the fluid, the now lymphatic fluid, which in this case contains bacteria, away from the blind end into the general lymphatic system, into the lymphatic vasculature. So these cells are actually contractile. So when these cells contract, they're going to squeeze the tissue fluid down that way. It's not tissue fluid now, of course, it's lymphatic fluid down that way, with any bacteria or proteins it contains. But then when it gets wider again, when the endothelial cells relax and the capillary dilates, then when it dilates, that's going to have the effect of reducing the pressure in this lymphatic capillary. And the pressure there will drop to being lower than in the interstitial fluid, in the interstitial compartment. And that means as the capillary dilates, once again, material is going to flow in to the lymphatic capillary from the interstitial space. So the capillary can contract, propelling the fluid out. When it relaxes, the pressure is going to drop, and more material will be sucked into the lymphatic capillary to go away and enter the general lymphatics. But this diagram shows a very important principle in the lymphatic system. It drains bacteria away from the tissue spaces. That means the bacteria don't get into the blood, but they enter the lymphatic vessels. So here we see a cross-section of a lymphatic capillary with the endothelial cells here. And notice that the endothelial cells are overlapping each other. They're overlapping. This means that material can get in here. This part of the cell can flap down to let material in. But then if the pressure in here increases, as it will do when the endothelial cells contract, the material is going to have the effect of closing that valve. It's going to flap shut. So material gets into the lymphatic capillaries but can't readily get out of the lymphatic capillaries. Overlapping flappy cells with an incomplete basement membrane. Now this diagram up here we see the blood going into an arteriole, going through the capillaries and leaving via the venule. And here we see that tissue fluid, of course, has been formed, entering the interstitial space. Most of it, of course, as we've looked at, is reabsorbed into the venous end of the capillary, but the tissue fluid which is left, with any proteins which have escaped from the blood capillaries, is going to enter the lymphatics. So here we have the normal tissue cells. The lymphatic capillaries, as we see, are in between the cells in the interstitial spaces. Once the material has gone from the interstitial space into the lumen of the lymphatic capillary, then the fluid changes its name to lymph, and this is going to drain away in these lymphatic capillaries, and it will drain into progressively larger lymphatic vessels. And here we see another lymphatic vessel that is attached to another set of capillaries. So different sets of capillaries are going to drain in, forming progressively larger lymphatic vessels. Now these larger lymphatic vessels are themselves contractile. In the larger lymphatic vessels there is contractile cells around about the vessel, rather analogous to smooth muscle. But as well as that, the general movement of the limb is going to cause the movement of lymphatic fluid. The contraction of muscles is going to press on lymphatic vessels. Pulsation from adjacent arteries is going to change the pressure in lymphatic vessels as well. So, although the lymphatic vessels are contractile, then there's also movement of the lymphatic fluid through movement of adjacent structures. And importantly, we notice that the lymphatic vessels here contain valves. They contain valves. So when the fluid is moved from this part of the lymphatic vessel into this one, the valve will shut and not let the fluid go back again. So there's valves to ensure one-way flow from the capillary end to the larger lymphatic end. The fluid will flow away from the lymphatic capillaries. The fluid will flow away from the tissue spaces into progressively larger lymphatic vessels. Now, before we move on from lymphatic capillaries, there's one more thing I want to tell you about. So let's draw a lymphatic capillary in the tissues. And remember, the endothelial cells are overlapping in a lymphatic capillary. So here we have some overlapping endothelial cells. And here's the blind end of the capillary. So we've got these overlapping endothelial cells. And of course in the tissue we have tissue cells. So here we have some individual tissue cells. And we've noted that there'll be tissue fluid in the interstitial spaces here. Now, from time to time, there can be a build-up in the volume of interstitial fluid. And if the amount of interstitial fluid builds up too much, what do we call that? What do we call an excess of interstitial fluid? There's a special name for it. That's called edema. In America, of course, they don't use the O, but edema. So edema is an abnormal situation where there's too much fluid in the tissues, and we don't want that. But if you think about it, if the amount of tissue fluid is building up, and there's an increase in pressure in the tissue fluid, what's that going to do to the lymphatic capillary? If there's more pressure here, what's that going to do to the lymphatic capillary? Well, more pressure here is going to tend to close down the lymphatic capillary, reducing the lumen of the lymphatic vessel just when we want an increase in the amount of lymphatic fluid drainage. So that would be the opposite of what we want. So there's a bit of a problem here, isn't there? So what we have attached to the endothelial cells, there are radial or anchoring filaments of tough connective tissue attached to these cells. Tough connective tissue attached to the cells. Now, these are also connected to the collagen that is in the tissue. So if you think of a tissue like, for example, the dermis, below the epidermis in the skin, there's a lot of collagen fibers running through that tissue. And collagen is tough, strong, tensile protein. It gives the skin an awful lot of integrity, so it's hard to peel it off. It's got high tensile strength. And these are fibres running through the tissue. So here we have collagen fibres, a network of collagen fibres running through the tissues. And what we notice is that these anchoring radial filaments are attached to the collagen fibres. So collagen fibres running through, networks of collagen fibres running through the tissues. Now, what this means, if there is an increase in the amount of interstitial fluid, that will tend to push the collagen fibres apart, the increase in pressure. And because the anchoring radial filaments are attached to the collagen fibres, that's going to pull these apart as well. And that's going to tend to pull apart the endothelial cells of the lymphatic capillary. And of course, that's going to make the lymphatic capillary wider. There's going to be an increase in the lumen. And as well as that, when you pull these cells apart, it's going to increase the size of the gaps between the endothelial cells. So if there's an increase in the amount of interstitial fluid, that's actually going to cause dilation of the lymphatic capillaries, allowing more lymphatic drainage. So it's a physiological compensation system based on the anatomy of these radial anchoring filaments and the collagen fibres in the tissues. So if the pressure increases, the lymphatic capillaries will be dilated, thereby increasing the amount of fluid that can drain at any one time. And that will prevent, or unless depends on the cause, but to a large extent that's going to prevent the formation of an abnormally large amount of fluid in the tissues. It's going to prevent the edema because of this anatomical structure of the anchoring filaments and the collagen fibres.